Welcome to Emergency Insights. I'm your host, James Carter. Today, we're dissecting into an important clinical question. Can we trust a normal ECG to rule out hyperkalemia? Let's explore what the evidence tells us to help you make safer bedside decisions. Imagine a 76-year-old woman arrives in your emergency department. She's complaining of generalized weakness and poor oral intake for 2 days. Her medical history includes hypertension and chronic kidney disease. On exam, her heart rate is 108, respiratory rate is 24, mucous membranes are dry, and her capillary refill is delayed, suggesting dehydration. You order blood tests, start IV fluids with Ringer's lactate, and get an ECG, hoping it might give you clues about her potassium status. The ECG turns out normal. You might wonder, does a normal ECG mean she's not hyperkalemic? This is a critical question because hyperkalemia can be life-threatening and timely recognition is crucial. Let's look at the data. A recent study evaluated over 1,600 emergency patients and focused on how well ECG changes predicted hyperkalemia. Cardiologists reviewed these ECGs independently. Here's the key takeaway. The sensitivity of the ECG to detect hyperkalemia was quite low, around 39 to 47%. This means the ECG missed more than half of the patients with elevated potassium. Even strikingly high potassium levels, greater than 8 millimoles per liter, sometimes showed no abnormalities on the ECG. Specificity was better, between 76 and 81%. When ECG signs like peaked T waves, widened QRS complexes, or flattened P waves were present, they were meaningful indicators of hyperkalemia. In other words, if the ECG is abnormal, it's helpful and warrants immediate attention. But if it's normal, do not be complacent. Why is this important for you at the bedside? Relying solely on a normal ECG can give false reassurance. Hyperkalemia is a biochemical diagnosis and requires lab confirmation. In emergency and acute care settings, always get serum potassium levels when suspicion is present, regardless of ECG findings. Any delay in diagnosis can lead to dangerous cardiac arrhythmias or cardiac arrest. At the same time, don't ignore ECG changes if you see them. They can guide urgency in treatment. So, what do you do in practice? Always interpret ECGs in context, but don't let a normal ECG rule out hyperkalemia. Prioritize rapid blood tests to measure potassium, especially in patients with renal impairment or those on medications like ACE inhibitors. Watch for clinical signs like weakness and poor intake that raise suspicion. Treat promptly if hyperkalemia is confirmed and monitor ECG continuously. To wrap up, a normal ECG isn't a reliable screen to exclude hyperkalemia. Laboratory potassium measurement remains the gold standard for diagnosis. Use the ECG as a tool to help identify severe cases, but never as the sole gatekeeper. Thanks for joining me on Emergency Insights. Stay vigilant, trust your labs, and keep your patients safe. I'm James Carter, looking forward to our next update.